Candace, multiple advocacy groups are appealing to the federal government, hoping that the Centers for Medicare and Medicaid will stop this list of 800 diagnosis codes from becoming the sole determination of how much medical providers get paid for their work. The list of so-called preventable emergency room visits includes things like diabetic ketoacidosis or an asthma attack. If a Medicaid patient is diagnosed with a condition on that list, the state will only reimburse the hospital $14.98. Doctors say the financial impact of that will make it more difficult to fully staff emergency rooms.
So it puts Medicaid patients in a position where they must self-diagnose and try to determine whether they have an emergency or not, which historically means that many of them won't come in and their conditions will get worse and some will die.
The legislators who proposed this cut in Medicaid payments say the goal is to incentivize emergency rooms to help direct patients towards establishing ties with a primary care doctor.
But if all they're doing is taking care of the patient, send them home and say, oh, we'll see you the next time you show up here, they're not going to, they're not helping anybody.
Doctors and hospitals argue that the reimbursement policy is unfair because they are legally obligated to treat patients for the symptoms that they come to the ER and present, not based on what their possible final diagnosis could be. This change is set to take effect on Wednesday. The problem solvers are working on your medical bills. We've helped viewers save more than $125,000. If you received a health care bill you weren't expecting, tell us about it with as many details as possible at WTVR.com/yourbill. Working for you, Bree Season, CBS 6 News.